Cunningham. I am pursuing a Master's of Science in Professional School Counseling. My research presentation will be over mindfulness-based stress reduction to reduce anxiety. Anxiety is a part of life in general. However, the prevalence of young people with anxiety is on the rise, as it is the sixth leading cause of illness and disability among adolescents aged 10 to 14 years old. As a middle school counselor, I see and hear about anxiety students face on a daily basis. Studies have also shown that students who have intense anxiety tend to have more health problems. Since this is so common among young people, research must be conducted in order to find treatment. Several studies have been conducted to help find relief for these young people struggling with their anxiety. However, the use of mindfulness-based stress reduction has shown promise in this area. According to Zhao et al., current evidence indicates MBSR has superior efficacy compared to controlled conditions in treating young people with anxiety symptoms. The major problem is the need for a targeted way to help students alleviate their anxiety. Right now, there are many options, but they may be narrowed down to ones that are the most effective and that can be carried out in a school setting. While all stakeholders, administrators, parents, and teachers should be concerned, this particular topic is of interest mainly to school counselors, as they are the ones dealing with the anxiety in students on a daily basis. Without a targeted approach that shows it will directly benefit students suffering from anxiety, the impact on the field of counseling is great. We need a way to help these students now. The purpose of this study is to test the effectiveness of mindfulness on a rural population of middle school students age 11 to 14 in the reduction of anxiety. This information can be very valuable in the counseling community. This research will inform counselors of a way in which to alleviate some of the anxiety their students are experiencing on a daily basis. This is important because anxiety levels are on the rise, and we need a way to help reduce the levels of anxiety in our students. This study will seek to answer, does MBSR affect anxiety in rural middle school students age 11 to 14? The independent variable will be MBSR. The dependent variable will be the level of anxiety in the student. The variable is also quantitative and an amplitude variable. Studies have been conducted and found MBSR effective on reducing anxiety and mental health issues among young people. These studies have not examined how an adolescent setting, such as rural or urban, may affect the effectiveness of MBSR. This is an important aspect of studying the effectiveness of MBSR, as the specific strategies and even the overall effectiveness may change based on where the subject lives. Most studies are also focused on a large age span of young people. This does not give a clear picture of how MBSR works for younger adolescents specifically. While several studies have been conducted with older adolescents in no specific setting, there is a deficit in studies that have been conducted with middle school subjects 11 to 14 years old who live in a rural setting. There's a range of ways to use MBSR strategies in practice in schools and mental health professional practices. Dalakashimi indicates yoga and relaxation may be implemented in schools as part of a school curriculum. Zhao et al. Suggests using hatha yoga. The study also recommends using body scans, sitting and breathing, and walking meditation as forms of MBSR. Van Villay et al. Had a similar approach as they use walking meditation, body scans, breathing, and yoga as MBSR approach to treating anxiety among young people. Similar to the other studies, Diaz-Gonzalez et al. Used sitting and moving meditations, body scans, and hatha yoga during their study. Through the use of a wide variety of MBSR strategies, one can see a clear picture of anxiety reduction in these studies. The reduction of anxiety is the goal of MBSR strategies, and this can be seen throughout the literature. Dalakashimi indicates using MBSR practices reduce levels of anxiety in the subjects. Zhao et al. Shows MBSR to be significantly superior to control conditions in reducing anxiety in the meta-analysis conducted. Van Villay et al. Shows their quantitative research participants consistently mentioned how MBSR reduces their levels of anxiety. Bahura et al. Showed MBSR as was effective based on the teacher ratings of internalizing problems such as anxiety of their students. In the study by Diaz-Gonzalez et al., state anxiety decreased more in the MBSR plus Tau group than in the Tau group alone for their subjects. The research clearly shows a decrease in anxiety when MBSR strategies are utilized among young people. While this treatment is effective, it is not immediate. The treatment takes place across several weeks. Using MBSR strategies does not happen immediately. The standard across literature is using the strategies over an 8-week time period. Dalakashimi indicates they use an introductory session followed by an 8-week schedule of sessions. Van Villay et al. Shows their young people completed an 8-week MBSR schedule program. Bahura et al. Discusses the use of 8 MBSR sessions for 2 weeks, indicating an 8-week program. Diaz-Gonzalez et al. Had their subjects complete a questionnaire at the baseline and then again after 8 weeks of the treatment. MBSR may not be an immediate fix to anxiety. However, it proves effective over an 8-week program. The literature shows MBSR has been revealed to reduce anxiety through a wide variety of practices. However, there is still a gap in the literature when one considers the subjects aged 11 to 14 who are from a rural setting. More studies must be conducted to see if the treatment of MBSR is as effective as it is in other geographic areas on young adolescents. The proposed methodology for the collection of data for this study is through a quantitative approach through a survey design. The study will take place over the course of a short time period, approximately 10 weeks, including an introductory session, an 8-week course of intervention sessions, and a final session. Questionnaires will be used as pre- and post-tests. The study will target middle school age students aged 11 to 14 from a small rural school. Probability sampling strategy will be used through the systematic random sampling technique. Students will be recruited through email explaining the research process and their important part in the process. Email will go out in the fall to ensure this is a long enough time period for the MBSR to take place before the second set of data is collected. A free homework pass will be offered for both the initial and second set of data collection times. Parents will also be recruited through email. The study will take place at a small rural middle school in South Texas. The majority population is Caucasian, however, the large population of Hispanic students as well. The overall population of the students is 210 students. During this study, the use of surveys and questionnaires will be employed. A state trait anxiety scale for children will be used. The reliability and validity of this scale is well established. A questionnaire created by the researcher using a Likert scale for questions will also be developed and used for the research project. Google Forms will be used to fill out data questionnaires. The validity will be checked by the researcher as well as the school administrators by sampling the questions with a small pool of participants first. The state trait anxiety scale will be administered on Chromebooks during the intervention period for the students. This will be a pre- and post-test data collection opportunity. The test will be administered online before and after the MBSR program period. The data will be analyzed using the user's manual given with the test. Data will be compared to find differences and similarities in the levels of state and trait anxiety in the participants' pre- and post-study. A researcher-created survey will be administered to a small pool of participants to test the validity. Any necessary changes will then be made and the survey adjusted accordingly. Then the survey will be given as a pre- and post-test before and after the MBSR program. Google Forms will be utilized to collect the data. The state trait anxiety scale will be scored based on a user's manuals for the scale. The data will be analyzed using SPSS 20 to compare the effectiveness of MBSR plus treatment as usual and tau. Each dependent variable will be analyzed post-treatment with ANOVA. The researchers will then use the treatment group as a categorical factor and pre-treatment values of each dependent variable, such as the state anxiety and trait anxiety levels as covariate. The levels of state and trait anxiety will be analyzed both pre- and post-test. For the researcher-created survey, the Likert scale questions will be given a value of 1 to 5. The data will be downloaded from Google Forms and analyzed using SPSS 20 to compare the effects of MBSR plus tau and tau. Researchers will then use the same categorical factors mentioned previously for the anxiety scale. The covariate will be the levels of mindfulness. A t-test will be performed of the pre- and post-test to see if the results are by chance or reliable. This should also tell if the participants are helped by mindfulness over a period of time. It is known anxiety is the leading cause of illness and disability among adolescents aged 10 to 14 years old. Since we know this problem is significant, the research to help solve it should be significant. This research study aims to help find a tool to use to reduce anxiety in young adolescents. However, there is a gap in research in the area of young adolescents age 11 to 14. There's also a gap in the geographic significance of the students' homes. There's a deficit that can be filled with this study. Using MBSR as a way of helping students deal with their anxiety could have a significant impact on the rest of their lives. With the information gathered through this study, professionals will know how best to implement practices of MBSR to help serve their students. These are the references used in my presentation.